Welcome to the Nutrition Research Update from the Renaissante Institute of Integrative Medicine. Hi, I'm Dr. James Meschino. Our topic today is the natural management of migraines, migraine headaches, which affect about 1 in 19 adults. 75% of migraine sufferers are women, and actually 3 to 7% of all children suffer from migraine headaches as well. So it affects about 1 in 4 people, or 1 in 4 households across North America. Now, of course, with migraines, they're different than other types of headaches. They're usually one-sided. They're often very severe. Often there's a pulsating feature to them. They can last anywhere from 4 to 72 hours. And often there's an aura that precedes the migraine. And sometimes there's nausea, vomiting. There's often sensitivity to light and to noise. People have to be in a very dark room with no noise. Now, the medical treatment of migraine headaches uses certain drugs, but the drugs are primarily drugs that help to abort the migraine as the migraine is starting. The different types of drugs that are used to sort of help shut the migraine down are not usually drugs you can take every day for prevention because they'd be too toxic. But there are some proven steps that can help to decrease the frequency of migraines, and that's what I want to talk to you about today. If you can reduce the frequency of migraines from 50 to 70%, that is definitely going to help the person with migraines have a better quality of life and less suffering. So the evidence suggests that the way to do that is through the right supplementation program, dietary changes, and also chiropractic care. So let's start with supplements first. There are 2 amazing supplements, 2 herbs in fact, that help to reduce migraine frequency. The first one is known as butter burr. Studies published in the Journal of Neurology in a large clinical study showed that it reduced the frequency of migraines by 50% in migraine sufferers compared to the group given the placebo. Then the same thing we saw in the journal Headache, where we saw a 50% decrease in frequency in the people who took the butter burr supplement, and also in the journal Headache, even looking at children. Butter burr supplementation reduced migraine headaches by up to 77% in children who are migraine sufferers compared to the group given the placebo. So how does it work? Well, butter burr contains active ingredients that block the inflammatory chemicals in the arteries of the brain that are largely associated with migraines. And it also has an antispasmodic effect on those blood vessels. So often in a migraine, the blood vessels constrict very early on, and then inflammatory chemicals get released. So the active constituents in butter burr help to prevent that spasming of the blood vessel and also decrease the release of inflammatory chemicals. So if you're using it on a daily basis, you preempt any type of migraine attack. The other herb that's very noteworthy here is known as feverfew. So in studies in clinical drug investigation, we saw that feverfew was able to reduce the frequency of migraines by 50%. And also in the journal Headache, another study showing a 50% reduction using feverfew. And then a study by researchers from the University of Maryland noted a 70% reduction in migraine headaches, the frequency of migraine headaches, in individuals who were migraine sufferers, who they followed for a certain length of time, very large population in fact. So feverfew contains an active ingredient called parthenolide. And parthenolide seems to work on different mechanisms around preventing migraines, decreasing inflammatory brain chemicals in the blood vessels, and also helping to regulate blood flow through the brain more evenly to stop, again, that spasming effect. So the best recommendation I can give you is that if you're a migraine sufferer, I believe it's in your best interest to take a supplement that contains both butter burr and feverfew together. You're going to get really a nice synergistic effect. But you need to make sure you're getting the right dose and the right standardized grade. So in the capsule, the butter burr should be 75 milligrams, standardized to 15% sesquiterpenes, which are the active constituents. And then feverfew should be 325 milligrams, standardized to a minimum of 0.7% parthenolide. Those are the active ingredients that get the job done, and those are the dosages that work if you'll take 1 capsule twice a day. There are other supplements that have been shown to be helpful for migraine sufferers to prevent them. Taking additional magnesium, 300 to 600 milligrams a day, some studies show reduces the frequency of migraines. And I think it's best to get that magnesium from a high-potency multivitamin that also has a B50 complex, because certain B vitamins are linked to a reduction in migraine headaches as well. Magnesium relaxes blood vessels, so there's less chance of vasoconstriction or that spasming happening, which is often the first event in a migraine. There's also a supplement known as 5-HTP, or 5-hydroxytryptophan. Many migraines, a certain class of migraine drugs actually works by stimulating the 5-HTP receptors on the blood vessels in the brain. And when you stimulate those receptors, you help to stop certain inflammatory chemicals being released and blood vessel spasming. So by taking 5-HTP, which is a natural supplement, you're stimulating those 5-HTP receptors in the brain, decreasing vasoconstriction or the spasming, and blocking the release of inflammatory chemicals known as these certain neuropeptides, as they're called. So the dosage for 5-HTP would be 200 to 600 milligrams per day. Several studies have shown that that's valuable. For children using 5-HTP, the dose would be lower, it'd be 20 milligrams for every 10 pounds that they weigh. Now, 5-HTP can also make you very drowsy because it gets converted into serotonin and some into melatonin. So you have to be careful with high doses of 5-HTP. Another supplement, though, are the essential fatty acids. A lot of people take essential oil supplements, and it helps with migraines because it helps the body make prostaglandin series 1 and series 3, which stops vasoconstriction and inflammatory chemicals from being released in the brain. So to me, if you're going to use essential fatty acid supplementation, and you should for a variety of reasons, but if you're a migraine sufferer, it will help as well. But it should be the combination of flaxseed with fish and borage seed oil. So flaxseed oil with borage seed oil with fish oil in one capsule, 400 milligrams each of those oils. If you're taking 3 to 6 capsules a day, it should help to decrease those inflammatory chemicals. And as I alluded to earlier, B vitamins some studies have shown they reduce the frequency of migraine. Riboflavin, vitamin B6, they've been shown to be useful. Why? They affect nerve function, they improve brain blood flow, they decrease a chemical called homocysteine, which is related to damage to blood vessels in the brain. And magnesium works in conjunction with vitamin B6. So anytime you're going to take magnesium, you need B6. Anytime you take B6, you need magnesium. They work in the same chemical reaction. So to me, the solution to the magnesium and B vitamin component is to take a high-potency multivitamin that has a B50 complex in it and at least 200 milligrams of magnesium. Then if you need more magnesium, you can add it beyond that level. So that's the supplementation side. Chiropractic is also very valuable in helping decrease the frequency of migraines, and I know that from having seen so many patients. A lot of pressure up here and behind the neck in what's known as the suboccipital triangle. Any nerve entrapment in there can produce tension headaches and aggravate any type of headache. And so the chiropractors can find those disturbances and mechanical faults and nerve pressure situations and reduce the pressure on those nerves because they contribute to headaches. Also, some light tractioning can release pressure on that nerve entrapment. Soft tissue work is also very helpful to break up the trigger points and release some of the adhesions and contractures that can amplify any type of headache, including migraine headache. And then if a chiropractor is using acupuncture, some studies using acupuncture have shown it improves nerve function, improves blood flow to the brain, and so that can be a nice adjunct to chiropractic care. And chiropractors can also teach you progressive relaxation so that your own internal chemistry, you can keep it at a calmer level, not secreting some of the hormones that can trigger stress-related migraines. Some other considerations. Some food allergies can produce migraines. Some environmental sensitivities can trigger migraines. Leaky gut syndrome, where you don't digest food completely and certain things escape into the bloodstream and produce immune inflammatory reactions, upset the nervous system. They can also produce migraines. So I would suggest if you're a migraine sufferer, one of the other things you do is you see an allergist, get tested for any allergies that you have that may be triggering the migraines as well. Find a holistic practitioner that can look for environmental sensitivities or leaky gut syndrome that may also be a factor, and then you alter your diet accordingly. So what I suggest you do after you watch this video is you see the diet and supplementation protocol for migraine prevention that I have listed in the recommendations below this video. If you're a migraine sufferer, I hope you found this information to be helpful. And if you know someone who has migraines, I would hope that you would forward this video to them so they can get a more comprehensive look at what migraine management should look like and what the supplementation and lifestyle factors and dietary factors should be, as well as chiropractic care in preventing migraines and helping to deal with them more effectively. So once again, thanks so much for watching, and I'll see you next time.